I'm William Simpson, President and Chief Executive Officer for DisposeRx. Welcome to our webinar, Medication Disposal, Prevent and Protect. This presentation is a result of a strategic affiliation of CLM Pharmacy Advisors, Pharmacy Management Consultants, and Real Solutions Group. And we thank them for allowing us to be a part of this important discussion. Our presenters have a real passion for today's topic, medication disposal. And I am sure that will be evident to you as you listen to their content. Joining me are Cameron Catazone from CLM Pharmacy Advisors, Ann Hamlin, Vice President of Scientific Affairs for DisposeRx, and Carol Dorn Sanders, Vice President of Marketing and Communications for DisposeRx. Carmen, thank you for leading us off today.
Thank you, William. Welcome to our first Alliance-sponsored webinar. As William mentioned, my company, CLM Pharmacy Advisors, has partnered with Real Solutions Group, formerly NABP Solutions, and Pharmacy Management Consultants to form an alliance supporting pharmacy and drug supply chain regulatory needs. The alliance enables 3 distinct organizations to seamlessly support any aspect of pharmacy regulation and supply chain compliance needs. One of our goals is to regularly provide educational content to stakeholders and partner with stakeholders such as DisposeRx, who has a genuine and sincere interest in improving patient care and recognizing the pharmacist as a critical member of the healthcare team. We want to thank DisposeRx for their leadership and their commitment to patient care. And if you have any questions about the Alliance regarding this webinar or other information, please contact us at Partnership Inquiries, all one word, at Real Solutions Group, all one word, .co. We'll begin the presentation now. Our interest in medication disposal is rooted deeply in patient care and providing useful tools for patients and pharmacists to help combat the struggles that people are facing with opioids and other controlled substances. Pain management and other therapies that utilize opioids and controlled substances do not conform to cookie-cutter therapies. Every patient requires careful and individual care. Too often, this does not occur, and patients are prescribed and dispensed more opioids and controlled substances than needed, and in many cases, that is safe. Studies have shown that when opioids and other controlled substances are overly or inappropriately prescribed, that excess medication finds its way into the hands of family and friends. Those family and friends have not been legitimately prescribed these powerful and dangerous medications. As a result, medications that should serve an important purpose are often abused and diverted and lead patients to suffer from long-term opioid use and dependence. Disposing of these medications appropriately is critical to resolving this issue and ensuring that opioids and other controlled substances are prescribed and dispensed as required and as directed. Next slide, please. And although the focus is often on the opioids, the other controlled substances that need to be carefully monitored and appropriately disposed of are listed on this slide. They include CNS depressants, such as benzodiazepines, as well as CNS stimulants, such as biamphetamines. The remainder of this webinar will provide important and evidence-based information about the problem and successful solutions for disposal. Ann Hamlin from DisposeRx will now discuss some of the recommended means of unused drug disposal.
Thank you, Carmen. As Carmen mentioned, I'm going to talk about some of the recommended means of unused drug disposal, as well as some of the resources that are available now. So we've all been very familiar with some of the federally recommended methods of unused drug disposal. And they come from, first, we'll talk about the FDA's guidance or the Food and Drug Administration. They recognize a flush list. And what that flush list is a list of medications that it's okay, in their opinion, to flush in your home. So they've also got guidance for if there's a medication that is not on this flush list, you can dispose of that unused medication in the trash. But first, it needs to be mixed with what they call an unpalatable substance, such as dirt, cat litter, or used coffee grounds. They recommend that you take that mixture, place it in a sealed plastic container or a sealed plastic bag, and then throw it in the household trash. In addition to those recommendations, they want you to take the original vial and the label with all your personal information on there and mark that out or peel it off, and then throw away that vial into the trash as well. More recently, since these at-home technologies have come on the market, the FDA has acknowledged them on their website. And what they say is that other technologies which provide additional options for disposing of medicines have been developed. The second organization is the EPA, or the Environmental Protection Agency. They also provide guidance for unused medication disposal. They encourage the public to use take-back collection programs that accept prescription and over-the-counter medications. And as a second choice, they do offer guidance for disposal if a patient or a consumer needs to do it in their home. And those basically follow what we just discussed as the FDA guidance for household disposal. They also list a little bit of a caveat, since the EPA is always talking about hazardous waste, hazardous materials. So they specifically note that pharmaceuticals that are expired or unused by consumers are not regulated as hazardous waste by the EPA, and they're generally just considered municipal solid wastes. So again, there are no regulations imposed on unused pharmaceuticals that will be disposed of in one's home. And lastly, we have the Drug Enforcement Administration, or the DEA. And what they do is they provide guidance that directs the public to follow the FDA or the EPA guidance for drug disposal. And they also list drug take-back day and year-round pharmaceuticals disposal locations as options. And what those are, you may have seen in your community drug stores or pharmacies, the kiosks. But again, these are collection methods. National Prescription Drug Take Back Day, a lot of folks are familiar with that, and it is an event hosted twice per year by the DEA. And that's where you can bring all of your collected materials, your unused drugs, and dispose of them at a location that has been previously designated. So again, these are collection events. These events, or anybody that they call a registrant who has registered to collect unused medication, must comply with the standards that the DEA has set forth for collection of unused medication. We also need to address the environmental impact. When unused medication is not disposed of promptly and properly, it can lead to drugs leaching into the water system, and it can threaten marine ecosystems. We've seen this in a variety of articles that have come out over the past several years, where they found that there are small amounts of drugs actually in our waterways and in our ecosystem, and they believe that these come from medications that have been improperly disposed. So now we're going to talk about some of the newer resources available for patient disposal of unused medication. So at-home medication disposal solutions are on the market, and they utilize different technologies for disposal. One of them is activated carbon. The DisposeRx disposal technology uses something very different and very innovative, and that's cross-linking polymers. These polymers are used to sequester or remove the active ingredient of medication so that it can be disposed of safely in the household trash. We like to talk about 3 layers of protection that go into using a DisposeRx packet. When you use the DisposeRx packet, when it's activated with water in the presence of the unused medication, and it turns into a gel. So that gel is inside the actual prescription vial that is capped with a tamper-resistant cap. That is the first line of defense, or the first layer of protection, is the utilization of the tamper-resistant cap. The second layer, we like to talk about that actual gel that I just described. That cross-linking polymer gel is naturally resistant to tampering in solvents, so it does provide a layer of protection. The third layer is actually what's going on inside of the gel, and that's the cross-linking polymer. We like to call it a fishnet that's surrounding the active ingredient, rendering it unusable so that it can safely be disposed of in the household garbage. So when you consider the different federally recommended methods that I just discussed for at-home drug disposal, what you get with DisposeRx is a simple, convenient, and effective way to dispose of your medication in your own home. And now's a quick demonstration that'll show you how simple the DisposeRx product is. So there have been a number of studies done on at-home disposal technologies and whether they are actually useful in helping change patient behavior for disposing of unused medication. One of these are results that we received from research that was conducted at Shriners Hospital for Children, and it was published in the Journal of the Pediatric Orthopedic Society of North America. And this study was actually done with the DisposeRx packets. They had 355 participants. And basically what they concluded at the end of the study was that 95% did dispose of their medications and 92% disposed using the DisposeRx packets for their medication disposal. So what they did, or the methodology that they used, was prior to the surgery, the patient that was prescribed an opioid for postoperative pain was given a DisposeRx packet and an educational flyer. And the anesthesiologist reiterated the importance of medication disposal and did review the directions on how to dispose with the patient. The patient then had surgery. And the next step was at the first postoperative visit, the family with the unused opioids who had not disposed was encouraged to do so. But what they did find was at that first postoperative visit, 72% of families who had unused medication had already disposed of their unused medication. At the phone calls that were made 2 weeks after the first postoperative appointment, that's where the difference between the 72% and the 92% were that actually at the end of the study ended up disposing of their unused medication using DisposeRx. So in effect, they concluded that it was a viable method to change patient behavior so that they were disposing of their medication in their home when they decided they no longer needed that medication. So I'm going to turn over the presentation to Carol Sanders. She's going to talk about some great state programs we're participating in, as well as the benefits of disposal for patients and pharmacists.
Thank you, Anne. So as Anne mentioned, I'm going to talk about some state programs that are happening around disposal. And also I'm going to cover a little bit about the benefits of disposal, at-home disposal for patients and for pharmacists. So Anne mentioned the research, right? The Shriners research. And what we're seeing is that medication disposal, because the opioid epidemic and the pandemic, this collision that we've seen, medication disposal is top of mind for many, many organizations. We certainly, if you look at the research, that was a health system, right? The Shriners organization, but we also are seeing pharmacies. We know that pharmacies disposal has been top of mind for them. In fact, DisposeRx packets are available in more than 60% of the chain pharmacies nationwide. So health systems, pharmacies, and also health plans are eagerly talking with their members about the importance of medication disposal. And when we say that, we mean prompt and proper medication disposal. What's been really interesting in the past few months is that we are watching states across the country work on medication disposal as well. So I'm just going to go through a little bit, provide you with a summary of ways that we are collaborating with the states and making sure that different organizations within the state are talking about medication disposal and providing that critical education to patients. So in Alaska, the Board of Pharmacy initiated a program where they're actually purchasing DisposeRx medication disposal packets with state opioid response grant funds. And they are taking our packets out to rural and remote areas of Alaska that do not have disposal kiosks that Ann talked about available, right? And they also, through Project Hope, which is a program that's part of the Alaska's Department of Health and Social Services and the Board of Pharmacy, they are now bundling DisposeRx packets with naloxone distribution throughout their communities. I will tell you, we are seeing more and more of that, and we'll talk a little bit about it here in a second. But we're watching this bundling. There's real traction around that, and seems to be a trend with folks who believe that having the conversation about naloxone or Narcan and the potential for overdose, and at the same time talking about the need for medication disposal. So some really exciting things happening in Alaska. The Board of Pharmacy in Iowa reached out to us about a year ago, asking us if we would be part of a program that they started, again, using state opioid response grant funds, where they wanted to reimburse their pharmacies for providing that critical education about disposal. Pharmacies are already providing that, but the state of Iowa feels like they should be reimbursed, which is an incentive for them to provide this critical education to their patients. There was an expansion of Iowa's program, what they called their Narcan program, or naloxone distribution program. And the reason they wanted to expand and also offer disposal options, at-home disposal options, were that they were hearing, the Board of Pharmacy was hearing from the Iowa pharmacist that having a conversation with patients who have an acute prescription for opioids, having a discussion about possible overdose was very, very difficult. And so the Board of Pharmacy and especially their prescription drug monitoring program team felt like if they offered disposal options, that would be a better transition, an easier transition for the pharmacist to talk about when you no longer need these opioids, then we want you to dispose of them, right? And God forbid, should something happen, we're giving you naloxone so that we could reverse any overdose that might happen. And we have heard wonderful things since that program started in July of 2021 from pharmacists on how this has helped them have the conversation about disposal and about naloxone and the great qualities that it has for overdose reversal. Want to talk a little bit about Missouri HealthNet, which is Medicaid, the state Medicaid program in Missouri. They work with the Board of Pharmacy in Missouri to actually reimburse pharmacies, again, for providing an opioid disposal solution, which is DisposeRx in this case, and also provide the education. And they're a step above with their reimbursement. So they are reimbursing the pharmacies for the packet and also $12.70 for the dispensing and education. So a really great program there in Missouri. We feel like all of these programs, they're trendsetters, and we're watching this traction happen with other states as well. We have been in a program with the Ohio Bureau of Workers' Compensation. This is our third year in working with them. So any worker that files or actually receives an opioid prescription receives a DisposeRx packet. And then the pharmacy is reimbursed for that education. Again, you hear that reiterated time and time again. So it's the disposal tool and the education, and we know that's a best practice. And so that's the Bureau of Workers' Compensation program in the state of Ohio. And finally, I'll mention the most recent. So West Virginia Drug Intervention Institute recently launched a pharmacy reimbursement pilot with independent and regional pharmacies there, including Fruth Pharmacy and the CPESN network of independent pharmacies. They too are using state opioid response grant funds and other sources of funding. And the West Virginia Drug Intervention Institute will provide pharmacists with an education and a screening tool that was developed by North Dakota State University. And so we're really excited. The program will, they're in the training process right now with a full launch in April, and we look forward to getting those results. So we're excited about these state collaborations. We're in discussions with a number of other states that are seeing what's happening in these critical states that we've outlined here today. And so we look forward to broadening those state collaborations around the country. And now I'm going to talk a bit about medication disposal for the patients, right? What are the benefits to the patients? I've mentioned a lot about the education, but when you think about the criticality of getting medications out of the home, right? We've talked about medicine cabinets a lot, but we know that folks store their medications in their purses, their nightstands, their sometimes on their counters in their kitchen, maybe in a pantry. Removing that medication as soon as it's no longer needed is critical. We were starting to weave in more and more information about storage as well. Grandparents, right, who might have those colorful pill organizers, whether they leave it in a purse or out on their kitchen counter. It's really inviting toddlers or young children. It might look like a toy to them, and so it can be very, very dangerous. So as Ann mentioned about the behavior change, we think that disposal has been a bit of an afterthought for patients, and we're trying to weave it in so that every time they pick up a prescription, they are thinking about how they are going to dispose of it when it is no longer needed. And that could be a dosage change, or the medication is simply not working for them. Or in the case of opioids, we hope they are taking the smallest amount possible to alleviate pain, and then they're going to dispose of those medications. We talk a lot about the risks associated. It can be accidental ingestions, right, that we just talked about with grandparents and younger children at home, but it can also be for seniors who forget, who might be polypharmacy. They can also accidentally ingest medications. They can have a 5 milligram tablet that might have been upgraded to a 10 milligram and take both of them at the same time and end up at the ER because of those accidental ingestions based around confusion. We also know diversion, unfortunately, as Carmen talked about earlier, is a critical problem, whether or not that's someone in your home that's providing work or services, but it also can be teenagers or others, adults who might realize that there are opioid medications in a common area. And so we do know that diversion is a real problem and feeds the opioid epidemic. Overdoses, right, and suicides. We know overdoses are at the highest level they've ever been at, according to the CDC. And so that, I think, as well as the research that Ann referenced, I think the numbers that we are seeing from the CDC are so alarming that that's why medication disposal is considered a key prevention method. And then we like to talk about the folks who aren't able to get out to take back events, right? Or aren't able to go to a hospital or a law enforcement area that might have these kiosks available. There are older folks, there are folks who struggle with mobility or transportation issues, and having an at-home medication disposal solution is just a good thing for any of us, whether or not we have transportation or mobility issues or not. So those are a few of the patient benefits that we talk about. And then what are the medication disposal options and benefits for our pharmacists and pharmacies? We talked a little bit during the discussion about the state collaborations, how the pharmacies like the ability to talk about medication disposal while they're talking about naloxone and possible overdoses. But quite simply, pharmacists are asked almost on a daily basis about how patients should dispose of their medications, right? They want concrete options that are beyond cat litter and coffee grounds. They want something that's immediate, right, and takes the risk away from the household. So having at-home medication disposal solutions that provides that concrete option for them. And quite frankly, that's why the chain pharmacies provide medication disposal packets, DisposeRx packets to their patients when they receive medication, especially opioid prescriptions, right? So what we call medications of concern. They have baked it in to their opioid stewardship programs, much like the hospitals have done and health plans now. So it's important that the pharmacies and pharmacists talk with patients about the risk associated with leftover medications. We know that the pharmacists have a lot on them right now, especially with the pandemic and testing and vaccines. But this is a really great way for pharmacists to engage with their patients or those family members, right? So to talk with a new mom or a mom who might have a toddler at home or a mom who is going to pick up, or dad that is going to pick up a prescription for a teenager who's getting wisdom teeth removed and might have a first exposure to an opioid medication. This is a great way for that pharmacist to remind a patient or a parent about the risk associated with not just opioids, not just controlled substances, but quite frankly, almost every medication is dangerous in the wrong hands. And so this is a really great opportunity to talk about disposal with their patients, and it shows that they care in their community. And providing an at-home medication disposal tool and education, as I mentioned earlier, is a best practice. It is the ultimate way to change behavior and mitigate risks if used appropriately. So we believe, and we certainly are seeing this more and more with regional pharmacy chains and others, that it should be a standard of care. We also believe that the provider should have this an opportunity to talk with their patients about the risks associated with opioids and other medications of concern when they provide the prescription to the patient. But I think most people think of the pharmacist since it is at the time of dispensing. So the pharmacists have played this critical role, and we know they'll continue to play that critical role in the future. So we just wanted to leave you with a couple of simple thoughts. Medication disposal, it is all about prevention, and it's all about protecting yourself, your family, your friends, and your pets, right? So we want to encourage you to talk about this. If you need resources or you have questions, we want you to reach out to us. Here you'll find all of our contact information, Carmen's email, Ann's email, as well as mine. So if you need additional information, perhaps you'd like our FAQs or other documents about medication disposal, our website, DisposeRx.com, has a knowledge center, has a lot of information available to providers, pharmacists, and patients. But please reach out to us if you'd like to engage us, or you feel like we could provide information for perhaps a group that you're involved in. So we appreciate your engagement here today and participating in the webinar.